Mr. President, the Vienna Declaration emphasizes the responsibility of all states to develop and encourage respect for human rights and fundamental freedoms for all without distinction. For years, public policies aimed at people who use drugs in Brazil have been based on the privation of liberty either by criminalizing people who use drugs, especially black and poor, or by intermenting therapeutic communities. Therapeutic communities are private entities that provide temporary residential care to people with drug consumption problems, where their operating model is based on isolation, abstinence, and in most cases, association with religious denominations. Investments in health equipment and in the psychosocial care network have been reduced, while the transfer of resources to therapeutic communities which do not belong to the health system or social systems has increased. At the end of last year, a law was passed granting tax exemptions to these entities, in yet another demonstration of the drug policy's orientation. It happens, however, that there is no clarity about the type of work that is carried out by these entities, there is no proof of the effectiveness of the treatment methodology, nor transparent mechanisms of control and evaluation. There are indeed several complaints about forced labor, torture, and ill treatment occurring in therapeutic communities across Brazil, including alerts made by the SBT. We ask the Brazilian government to adopt a human rights approach in its drug policy making. There is an urgent need for an in-depth and democratic discussion about the public funding of the communities and its role in the Brazilian policy of care for people with problem drug use. Thank you.